We have a challenge in our country to end the marginalization of people who suffer from these illnesses. Because what we end up doing is adding insult to injury. So it's not enough that people are facing a biologically based illness, no different than any other illness, but they have to suffer the discrimination that accompanies those illnesses. I'm a very public face of recovery, and I'm in recovery today. I've been to inpatient treatment for addiction. I've been to outpatient treatment for depression and bipolar. I spent years parking my car 4 blocks away from my psychotherapist's office because I was ashamed to have anyone know that, yes, that was my car in front of the psychiatrist's office. So like everybody else, I was not only facing an illness, but I was facing the stigma. I love NAMI. I love every organization that tries to advance the cause of people who are suffering from mental illness. NAMI really understands that we not only have to advance treatment, but in order to do that, we have to end stigma. They are the preeminent organization in advocating for a new paradigm to treating people the same way we would expect to be treated for any other illness of the body.
Mr. Speaker, I rise in support of H.R. 6983.
I was honored to be the sponsor of the Mental Health Parity and Addiction Equity Act in Congress. We would not have passed parity had it not been for the advocacy of groups like NAMI, who mobilized their national network to get people to speak up against stigma, speak up against discrimination, and say we have to end the way people are being marginalized in our country because of their illness. NAMI's about kicking down the doors and opening up the light of day. We're all focused on this together, and we all have a vested interest in working together. It begins with people taking that first step, literally in a walk, but also figuratively in the change that takes place from that walk to change the world around them. These are Americans of all color, creed, gender, and religion and ethnicity. You know what? They have one thing in common. They're being marginalized because their illness occurs in the brain as opposed to any other organ of the body. That doesn't make any sense, and we have to change it. NAMI works on changing it, and I love NAMI for that.